Hey there, today's topic is pain and injury and how they are not synonymous. There are a lot of people out there, and even some antiquated physical therapists, that think that you have to have an injury in order to have pain. And I can tell you, from the scientific literature, we know that is not the case. I think an image that perfectly illustrates that is the one that we put at the beginning of the video, which shows the gentleman with a nail in his skull and into his brain. I'll tell you the story on that. This guy had started to develop some headaches. So he goes to see his doctor, and when the doctor did an x-ray, found the nail in his head. This guy didn't know it was there. So as the person started reflecting back on when he thought that may have happened, he thought it was like 4 years prior on a job site. Didn't know, didn't have any pain, didn't have any symptoms until years later when he started to develop the headaches. Okay, that's a totally crazy story, but it illustrates the point. I'm going to give you a couple statistics, and then we're going to talk about really what they mean and why you should care. Okay, so 40% of people that don't have low back pain, do not have low back pain, have a bulging disc on an MRI. 35 to 40% of the entire population that don't have shoulder pain have a rotator cuff tear on an MRI. And if you're over age 70, 2/3 of people over age 70 have a rotator cuff tear without any symptoms whatsoever, okay? You might say, whatever, why is that important? I'll tell you why. It's important that we understand how the brain works so that we as physical therapists can help you overcome pain, and specifically overcome chronic pain. And what I mean by chronic pain is any pain that's lasted over 3 to 6 months, we consider that chronic, and we have to treat it differently, and we have to treat your brain. In the upcoming videos, we're going to talk about what that looks like and how we do that. Stay tuned. We'll talk to you soon.